Pattaya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
G'day and Swadee. Well, also today, apart from Dr. Thachana talking about the risk factors for stroke and what to do, we also had a talk by Dr. Natchai from the Bangkok Pattaya Hospital about rehabilitation from strokes. And this is a really important subject. And one of the things that came across is that there's a time window, right? That you're much better off if you get serious about it earlier.
Yeah, because of the result of the rehabilitation is depend on what time we start. If it's early, it's a good result of the, and if you start early, it can prevent the complications. If some patient have complications, have a difficult to treat.
Yes, I had a friend, he used to be he was in the military in the US, and he had a stroke, so he went to a veterans hospital, and the doctor told him, said, 6 months. You've got 6 months, and you have to get everything is this military way of looking at it. 6 months, and that's all you get, son. You really have to get your act together in 6 months and get you as good as you can be, because after 6 months you ain't going to get any better. But that is critical, the first 6 months.
Right, because of it's not like a magic number. It's exactly 6 months. We have many patients who can recover after the 6 months. But why we call 6 months? Because of the first 6 months is a good period for recovery. If you put good rehabilitations, good treatment to the patients, the recovery is very quick.
And I was very impressed by how well equipped Bangkok Pattaya Hospital is with rehabilitation equipment.
Yeah, we have a lot of equipment. We try to improve every day, day by day, to promote the quality of the patients. Yeah.
And to get them off lying down flat, right? That's really important. You had tilt machines.
Yeah, we have many machines for try to improve the walking function. Just from the patient can just only lie on the bed till he can try to start to walk. This is many equipment. Yeah.
Yeah, I was really impressed, and they can play games while they're walking, right?
Yeah, we have a game with the train with the balance. We can have a game for during the hand function. This make the patient not too bored.
Yeah, and more motivated, right? What was the other thing that really impressed me? Oh, and you have simulated so that they can rehabilitate back into their home environment and be have independent daily living. You have special equipment for people who can't use normal utensils.
Yeah, the daily activity is important for the patient to be back home. We have you can train him to use equipment to improve the function of the daily activity.
So you got like a virtual kitchen, for instance.
Yeah, we have a simulation room. Before the patient go back home, we have like a simulation room to make he can more confident for back home.
Yeah, this is really cool stuff. So there you go. Bangkok Pattaya Hospital is to be congratulated on the level of equipment and rehabilitation they're able to offer. I know somebody who's gone through their rehabilitation programs with strokes, and they've been very impressed. I've been very impressed with how they turned their life around and went from like 150 kilos now down to like 100 kilos, got a target of 90 kilos, and they're on their way. So congratulations and gratitude to Bangkok Pattaya Hospital for this particular person's rehabilitation. So I want to salute you, Dr. Natchai and Bangkok Pattaya Hospital, and watch the talks, because you really educate yourself, you know. My grandmother had a stroke, my father had a stroke. It's going to happen to people around you. That's statistically what's going to happen. So you really need to educate yourself. But for now, from Dr. Natchai and myself and Bangkok Pattaya Hospital, it's goodbye and Swadee.